right now. So without any further ado, I'm going to turn it over to Dr. Popler and Dr. Graham, and they've got some slides they're going to present on.
Okay. Good morning, everyone. Hope everyone is staying healthy and at home as much as you can. I'm going to just, I just have a couple of slides just about what we know so far about COVID-19 and pediatric populations and their risks. And then I'll just shoot through those, and then we can answer some questions and have a little bit more of a extemporaneous conversation. Let me just go to the first slide. So I think, as everyone knows, the COVID-19 outbreak started in China and spread quickly through Europe, and now has made its way to North America. If you look at the Johns Hopkins virus tracker, which is available online, it does seem like it's starting to make its way into South America and Africa. Fortunately, there have been relatively few cases in children when you compare it with the total number of cases in the world. About 2.5% of the cases in China were of children younger than 19 years of age. And that seems to be in line with other coronaviruses that we've seen in the last 10 years, which would include SARS, which actually I think that occurred in 2004 when I was just finishing med school, and MERS, which is Middle Eastern Respiratory Syndrome, which was about, I think 5 or 6 years ago. Just a small minority of those cases were in children. For children, really all children, all comers, the symptoms are very similar to adults: fever, cough, difficulty breathing. The one exception in children that has not been the case in adults is that often children have gastrointestinal symptoms, abdominal pain, diarrhea, occasionally nausea and vomiting. So that can be a presenting symptom for children, which does not seem to be the case in adults. There are also many reports of children with asymptomatic infection. And I think that's one of the concerns and one of the reasons behind social isolation at this point, is that children can essentially be asymptomatic carriers. And that those data seem to be in line with the SARS and MERS experience as well, where, again, children who were infected with coronaviruses causing SARS and MERS did tend to have a milder course. The majority of symptoms do seem respiratory in nature, so certainly we can see some findings on chest X-ray, chest CTs, and we're not, and it's not completely clear if those are required when you're trying to make the diagnosis in children. So here in Atlanta specifically, but really throughout the country, you can make the diagnosis without chest X-ray and chest CT, because there is some viral testing that's available now. And then, so just switching a little bit more specifically to the US, only about 1 or 2% of children who had COVID-19 required hospitalization. Up to the period through March 16th, there were no ICU admissions or deaths. Since March 16th, there have been 2 deaths in children under the age of 18 who are COVID-19 positive, a teenager and a 9-month-old. I did not include it in the slide just for brevity's sake, but for both of those children, it is not clear that COVID-19 actually caused mortality events. The 9-month-old may have been a SIDS death, and the teenager also had sepsis, and they were tested while they were ill and found to be positive, but it's not clear that COVID-19 actually caused those deaths. Certainly in the teenager with sepsis, it's possible that there was a bacterial co-infection, but it's as I said, it's not clear what exactly happened with those kids. The other thing I wanted to mention is just in the system here in Atlanta and throughout Georgia, so far we've had about 15 children admitted to the hospital with who are positive for COVID-19. We've had 2 or 3 children who are admitted to the ICU, but as far as I know, we have not had any deaths in our system from COVID-19. Just looking specifically at children with medical complexity, we really don't have very good data regarding how COVID-19 would affect kids who are medically fragile. The Chinese experience was that there were 3 children who required ICU care from COVID-19, and all 3 had underlying chronic conditions, hydronephrosis, which affects the kidneys, leukemia, and then what was termed an emergent bowel problem, which may have been a bowel obstruction that also was not clear. We assume that children who are medically fragile, who would otherwise get sick with a respiratory virus or another virus and have a significant illness, would probably have the same response to COVID-19, but again, that's an assumption. It's not totally clear. Unfortunately, there are no antivirals yet approved by the FDA. I know there's been a lot of information, both in the medical literature and the lay press, about using azithromycin and hydroxychloroquine. Those studies are ongoing. The initial case series that reported improvement with hydroxychloroquine and azithromycin was really just an observational report. It's not clear that that really caused any improvement. There's some concerns about that case series that they actually didn't report any negative outcomes with using those medications, which may not have been entirely accurate. So I would say that the use of hydroxychloroquine and azithromycin has not been accepted yet. There also have been some studies with some antivirals, as well as interferon alpha. There's a couple of investigational antivirals that have been used for adults under clinical trials or compassionate use. So far, we don't know of any improvement or any efficacy in children. Dr. Graham and I were talking yesterday. There's another study of a biologic agent, which is an interleukin-6 blocker, which seems to stop, will have some activity in vitro against coronavirus. Again, we're not sure how that would be, if it would be useful in children. So really the recommendations we've made so far have really been just really prevention. So children 2 years and older should wear a cloth face covering, again, not to protect themselves, but also to protect the spread of virus from them to others. It sounds obvious, but good hand washing, soap and water, alcohol-based hand sanitizer, disinfecting high-touch surfaces daily. So, that would be anything that people are touching a lot of light switches, desks, toilets, sinks, laundering items, including toys as needed, and then obviously limiting time with older adults and people with underlying medical conditions, and also limiting people from really coming into the house who don't live there. And that's all for the slides. And then we'd be happy to take any questions. I'll throw it over to Dr. Graham if he wants to add anything.
Dr. Graham, I think your mic is muted.
That was an excellent presentation by Dr. Popler, and I think the point that he made is that the disease that we're likely to see in children, it may be very minimal and as such kind of indistinguishable from the common cold, but children are very, very important vectors, be they fragile or otherwise, and so I think protecting them when they do go out or protecting them with masks makes good sense, and also the surface cleaning, because they have the potential in the house, if they are asymptomatic carriers, to infect people in the household. The only other thing I'd like to bring up, and this is something that's been in the news and kind of like to get it out there, it's pretty evident that people of color, specifically, and the poor in general, are doing bad from this disease and have a disproportionate amount of hospitalizations and death. And while the reason isn't clear, there seems to be the same social determinants we've seen before in terms of lack of control of chronic conditions like high blood pressure, kidney disease, heart disease, and a variety of things, and also access to care. So I think that's important to share that if there are people of color on the phone, on the call, or your neighbors. This may be a disease that appears to be more morbid in people of color and people with limited access to health care.
And along those same points, so we're seeing limited access to healthcare for our patients now because we've really cut back our office visits. Our office is open, but we're trying to keep everybody at home. But our hospital system is trying to roll out telemedicine, which will be something that people can access. But I think, to Dr. Graham's point, to access that, you need an internet connection. You need the ability to use Wi-Fi and have a laptop. So it's still not perfect and can't reach everybody. But we are still, our offices are open. We're still calling patients and taking phone calls. But as Dr. Graham said, it certainly is affecting people of color. And that's really the increased mortality and morbidity is well above what we would expect from an otherwise healthy population.
All right, well, it doesn't look like we've got any questions yet from parents that are in on it. So parents, I'll give you all just a couple of minutes to type those into the Q&A portion. If y'all could do that for us, we'd appreciate it. Dr. Graham, Dr. Popler, is there any sort of resource for our parents to go to right now? Is there any place where they can turn where there's a compilation of information for them?
So I would say that if you want to look both globally and at the United States, cdc.gov has the most up-to-date information. And that was actually where I pulled a lot of the information about just infection rates and how quickly it was spreading through the US. So that I think that's a good resource. Our hospital system has put out a few statements about COVID-19. So if people want to look on children's choa.org, there is some information there. I should have mentioned, we're very aware that our fragile kids still need office visits. So there have been a couple of things that have been done to try to keep kids at home. So specifically for our tracheostomy and ventilator population, we're very concerned about those kids. So we have stopped having them come into the office. So we're really not having those clinics right now. But Medicaid has waived the requirement at this point for having office visits every 6 months, which is good. So that means we can still order supplies and put in orders for home DME companies and home nursing agencies to try to staff those kids and also get the equipment that they need without a face-to-face visit, which I think is great. And then we're being much more flexible than we typically are in terms of calling in medications. So, for example, and Dr. Graham can speak to this too, for our asthma patients, we do like to see them at least quarterly to make medication adjustments and send in refills. So right now we're not doing that. So, and as a practice, we used to say if you hadn't been seen in a year, we wouldn't do refills, but now we're just kind of refilling everything because we do want to keep the kids at home. Our hospital system has stopped doing spirometry and pulmonary function testing right now, just because of the current concerns about that test being a way to spread viral particles. So we've stopped that, and hopefully we'll restart that again soon when we have a little bit more information.
The only thing I would add to what John says is that those of you that do have some element of chronic disease, whether you're a fragile child or you have another child in the house with asthma, it is so very, very important to continue the basic therapy for those other conditions. Because again, we know that people that have comorbid or have other conditions, and asthma being a very prime example, are at risk for more hospitalization, more sickness in general, and though very small in children, overall more mortality. So I think it's important, and I think knowing John and the practice that I left, they are making themselves as available as possible to you, and it's wise to take advantage of that with questions or concerns.
Great. Dr. Graham, Dr. Popler, are y'all able to see the questions that have come through?
Yeah, I can see them
for you. Okay.
I think I see the first one from Amy. Is that
Yes.
the first one?
Mm-hmm.
Okay.
Yeah.
Why don't I read them and then we can take a crack at answering them.
That'd be great. Yeah.
My son has Lee syndrome, mitochondrial disease. Fever is a major concern. Sometimes requires a special IV solution. I'm worried about sending my child back to school if they open back up in the fall, given what everyone is talking about with the second round. So, I think that's certainly a valid concern. There may be a second round of infection once we get over this initial peak. I think right now it's difficult to project because frankly, we haven't really seen a peak in Georgia yet. The projection is that we'll peak in Georgia in the next 7 to 10 days, and then hopefully be on the downslope of infection or spread, really. I think we probably can give you better advice about that in the next month or two once we get through this coming peak. I will say I'm not sure that schools are going to reopen when they typically do in August for 2020, because I think we may not know yet what the infection rates are at that point.
Again, I agree with John. The one thing that it's not available yet, but one thing that will be coming, and it's very important to controlling this, is measure the people who have been exposed and have protection. And when that becomes available, that would also be another tool in how comfortable you might be having your child mix out or go out in the general population. Because it does appear that, as in other cases, children may have milder disease, and I don't know if that's, John can comment if that's their more robust immune system, but there are probably asymptomatic carriers that have developed some immunity. So again, while not available, that's going to be a very informative piece of information when that does come online.
We'll go to the next one. What can we do to access supplies that are hard to get now, like masks, disinfectants? I would say I think the beginnings of this really disrupted the supply chains, and so and obviously people are stocking up on a lot of that, which is making it difficult to get. Because I was listening to a interview this morning with somebody from Publix actually, who said it's not that we have the same amount of toilet paper we've always had. It's just people are buying more. So I think if you hold out a little bit as the supply chains come back online, and I think as people stop hoarding, I think those will be more available. You certainly, from a mask standpoint, a cloth mask and keeping outsiders 6 feet away from your child should be adequate. It's not perfect, but adequate. Disinfectants, soap and water should be fine for personal disinfecting. In terms of cleaning surfaces, I think I would make do with what I had until the supply chains come back online. There are some, you can kind of make homemade disinfectants. The other problem is it's not really clear how long coronavirus really lasts on surfaces. So I think once we know that a little bit, we have a little bit more information about that, we can do a better job with disinfecting. In the hospital, we're also running low on protective equipment and just, cleaning cloths and cleaning supplies. So I think that's a supply chain issue, which hopefully should be improving.
Yeah, and again, good point by John. A couple of things. There is an excellent video online with Sanjay Gupta showing how to wash your hands. And really, that's a pretty effective way of clearing it from your skins. And it does have to be about 20 seconds in doing that. As far as what John said about the household things, one thing that works very well is about a 60% bleach solution. You can also take bleach or alcohol and put it into, say, aloe, and you make a pretty good hand sanitizer that way too. And a lot of this stuff is easily accessible on the web. John's absolutely right. When this first started, I'm down here in Florida now, and we saw people driving out of Walmart with 2 carts full of toilet paper. And unless they have a bowel problem, that's just selfish. So, be mindful of that. But again, just good common sense, keeping surfaces clean once a day and so forth. And with the children with special needs, we understand they're touching a lot of things. So you want to follow around that and maybe even be a little bit more scrupulous than the general population in that regard.
So I'll just go to the next one. So as of right now, all therapies and appointments are telehealth. In a month or few weeks, when we're supposed to go back to normal life, how are we supposed to enter the world? I fear having to go out in the world again with the chances of my son getting sick. I think that's certainly a valid concern. I think telehealth hopefully will be here to stay, so we can keep our fragile kids at home. just speaking to our, I do a lot of multidisciplinary clinics like trach and vent, muscular dystrophy clinic, aerodigestive. I think all the physicians and other providers are trying to be cognizant of the fact that we don't want to bring those kids in unless we need to. In the children's system, all surgeries are on hold. And I think and we're talking about how to reopen, but I think it's going to be several months until we're back to where we had been prior to coronavirus. I think, I can just speak for our practice. We're trying to be very flexible with who we're bringing in. So right now we are seeing new patients, high risk asthma, patients who need biologic agents, and other kind of urgent follow-ups that need to be seen. But we've cut our practice way down. We have started doing telemedicine for cystic fibrosis patients, and that is going well. There's been a couple of technical issues, but we are trying to keep kids at home. And as I said, the regulatory requirements in terms of signing off on paperwork, seeing kids face to face have really been lifted. Even shockingly, and this is not really as much of an issue for our population, but for adults who are on narcotics for chronic pain, the DEA has waived a lot of the requirements for face-to-face visits to try to keep people at home. So I think the medical community is cognizant of that. And I would say if you're uncomfortable with coming to an appointment, reach out to the physician or the practice. I'm sure accommodations can be made. In the beginning, when we had more of our offices open, we were actually staggering appointments way more than we used to, like an hour in between patients, just so we could disinfect the rooms. Now, most of our offices are closed. We just have the main office open, but we're still disinfecting the rooms and keeping people about 30 to 45 minutes apart. So, we're doing our best to keep everything clean, but certainly if you have a concern about leaving the house and coming to an appointment, I would communicate with your docs. Let's see. Thanks for spending time with us today. Are you aware of the risks to our kids who are now older? I would say I think it's the same risks as any medically fragile kids. I think, for kids who have impaired airway clearance, who may not have a strong cough, who may have a weaker immune system overall, those kids are certainly more at risk. There have been young adults that have died from coronavirus when you look in the literature. But again, that does seem to be, I think those cases get more attention because it's very unexpected for a 30-year-old or a 40-year-old to die, which is good. But I think that, certainly the predominance of cases have really been in people over the age of about 55 and 60. And I think, that's just going to probably continue until there's a vaccine and until we have an antiviral. And I would say, just my opinion is that it's likely that most of the antivirals will not be that effective because there really aren't. I mean, even for other viruses, there are not a ton of antiviral medications that are effective. It's really vaccines that prevent the spread of viruses. I mean, there are, so for example, like for influenza, which is a virus, there are antivirals, but they can cut the course of the disease by a day or two, but they're really not curative like you would expect. Oh, you're strep throat, you get an antibiotic. So I think probably the most important thing is to, once the vaccine is available and we know it's effective, would be to get that.
Sorry.
Let's see. Sorry, I'm just scrolling down. Our POM appointment was yesterday, and Choa didn't communicate about how to handle it. My daughter's doctor is the last to switch over. Luckily, he ended up calling me because I contacted Choa. That's a concern I have, is in-person appointments with an at-risk kid. So yeah, I mean, I think, as I said, if you think you shouldn't come in, touch base with us. So, we're doing telemedicine. We're trying to do telemedicine over this kind of interface with like essentially a Zoom connection, although it's not Zoom. But we also are spending a lot of time on the phone with our patients. So it's not to say that you need like a WebEx or a telemedicine connection. I personally have called all the patients that have been canceled just to make sure they're doing okay, that they don't need refills. And I would say, the doctors are not very busy right now. I can say our practice is not busy. We have time to talk to you on the phone, more so than we typically do. So if you have an appointment set up that you feel you should not come to, if you reach out to us, we will touch base with you and talk to you about what we need to do. I mean, most of the kids I've talked to, most of the parents I've talked to in the last month, I have not said that they needed to come in because the parents know how they're doing at home. I've had some parents who I've contacted say I'd be more comfortable with a face-to-face visit, and I've brought them in. But a lot of the work that we're doing now can be done over the phone or over this interface. But I would say you don't need this WebEx or Zoom to talk to us. If you let us know, we're available. We'll give you a call, and we can talk about whether or not you need to come in. Can we have a copy of the PowerPoint? I think they are recording the presentation of the PowerPoint, so it should be available for you. How long does the cloth mask provide protection in public, and do cloth masks need to be washed in hot water after each use? So the cloth mask should be reusable as long as it's not obviously soiled. I would say if you have, I probably wouldn't go more than a day or two without cleaning it. Also, because we're still in a high pollen season, so if you're out and about with the cloth mask, there will be some contamination with pollen, and that's certainly an issue for most of us. So yeah, I mean, I think I'm blanking on what the current CDC recommendations are for how often to wash a mask, but I'd say 2 or 3 days, and then I'd clean it at that point.
Yeah, I've read something to the same effect about how to clean the cloth mask, and obviously it looks dirty, then that's a good sign. The other thing about the cloth mask, there's a great video with the Surgeon General showing how to do a trifold on that. You wind up basically with I'm sorry about that, the gardener. You wind up with a 6-ply cloth mask, which is pretty good. I was, until I fell off my bike recently, I was actually riding with one, and I did okay. But anyway, that's something that you can look up.
Let's see. Do you recommend sterilizing and reusing trach catheters now? Yeah, so I think if you are having trouble getting supplies from the DMEs, I certainly would do that. We do have some kids that change the trachs often, whether it's because of illness or other reasons. And so I do think sterilizing and reusing would be fine. If you're having difficulty with the DME sending you supplies, let us know. We have some contacts with the DME companies. We can at least talk to them about how far out they think the supplies are. I've spoken to Thrive a couple times over the last week, and it seems like they have trouble getting staff, having enough staff, but the supplies are there, and the supply chains for them at least have not been terribly disrupted. So let us know if you're not able to get equipment. How close do you think we are to a vaccine? So I'm not sure. There's, I think, something like 70 biotech companies working on a vaccine. I know Emory had a trial. They've not had any preliminary data yet. Frankly, most of the time vaccines can take 3 to 4 years to come out and be, studied as well as they should be. I don't think that's going to be the case with this because of the worldwide push to get a vaccine. And there's certainly been collaboration between the U.S. and other countries to have patients and get tested. The projections I've seen that I'm hopeful for somewhere around a year to have a true vaccine, which would be that would be remarkably fast and groundbreaking. But I think that is a reasonable projection. I don't know, LeRoy, you kind of more tied into industry. I'm not sure if you heard anything different.
Yeah, pretty much the same. There are some promising reports, but again, once these vaccines, and they got it right, they actually have to go through humans and see if they get a good response. So what may look good in initial research may not be effective. But I think it's unlikely that for the current season that would make any difference, even if we had one. And the most aggressive or optimistic have been like 18 months.
I think the other thing that is a little different about this coronavirus is that because children can be asymptomatic spreaders, they also may have an immunity before the vaccine. So, which is interesting. So one thing that may happen is that even before a vaccine is released, we're doing blood tests to see if you have an immunity, if you have enough antibodies, because at that point, then you could say, okay, well, yeah, you haven't gotten the vaccine, but at some point you were exposed to coronavirus and mounted an immune response. And so you're immune for now. The other question would be how long the immunity lasts, and that's down the road. But I suspect there are probably a lot more children than we realize that have been exposed to coronavirus, have mounted an immune response, and are probably immune. Unfortunately, the blood testing is not available yet on a widespread scale, so we don't know. And I think that's something that may change the shelter-in-place guidelines, and that may change how quickly, we're able to get back to kind of living a more normal life. Sorry.
No, on that same topic, the other thing that's being explored is what they call anti-serum, which if you find someone that has been infected and has mounted a good response way back with the pandemic in 1918, they would often give that product to people. And again, that's not available now, but that may be something that helps in the treatment of very severe cases. So, again, it's important to watch that space. But there are clearly, as John says, there are probably people walking among us who actually have contracted disease, mounted a sufficient immune response, and done quite well. And quite frankly, that population is more likely to be pediatric than anything else because of the robust response they have to viruses every year.
When vaccines are available, will high-risk individuals have first access? That would be great if that were the case. I would say that in our for-profit, money-driven healthcare system, often the way things should be done is not the way things are done. And so, I mean, what I would hope is that the vaccine, whoever makes the best vaccine, that is widely available to all patients in all countries. I would hope that the vaccine is made from an ethical standpoint, so we're not testing it in sub-Saharan Africa and South America, which I know has been thrown around by politicians. So, I mean, I hope all those things would be true. Often, when vaccines are released, it really becomes a question of who is able to purchase them and distribute them, unfortunately. So, I think big healthcare systems like Children's and, New York and places that have had huge outbreaks will get them. The question would be, do people who ordinarily have difficulty accessing healthcare services, will they be able to get it? Will health departments be able to give it out? I think to Dr. Graham's earlier point, people of color and people in lower socioeconomic status who often have trouble accessing our healthcare system, will they be able to get access to that vaccine? Those are issues. I think, just speaking, just from my opinion, I think one of the things with the coronavirus outbreak has exposed a lot of weaknesses in the US's healthcare system that we have not, but even though people have pointed them out before, they've not been addressed as robustly as they should be, to put it lightly. And so we're seeing what happens when you don't cover, a large portion of the population. When a large portion of the population doesn't have access to appropriate health care, this is what happens. It's interesting when you look at who is sheltering in place, it's people of higher socioeconomic status, and typically people who are white, who are not minorities, are able to stay at home and not work, whereas people of color and people who have a lower socioeconomic status are out working because they have hourly jobs and they live month to month. And I think that's when this is over, I think we should have a conversation as a healthcare system about how we're not covering those people appropriately. But anyway, to answer your question, my hope would be that the vaccines would be available. I think, speaking, this is a children's employee, I know children's would make a big push to get the vaccine and to have it available, just as we have with other vaccines. I'm sure, most pediatric offices, I would say in Atlanta, about 99% of pediatric offices provide all vaccines that are required. I know there are a few that, sometimes will, because having vaccines in the office is expensive. I know sometimes there are a few practices that will defer vaccination to county health systems. And that may end up being the case for a coronavirus vaccine, just in terms of access. But as I said, my hope would be that everyone would have access to it. I think maybe the last question, I think.
I think we had one more down at the bottom.
Oh, I'm sorry. Yeah, I mentioned. Let's see. You mentioned immunity. If someone has been infected and recovered, do we know if immunity developed for a season or a lifetime? So, we don't know. I think it depends on the characteristics of this specific coronavirus. But an immunity, frankly, can wane over time. So, taking something like the Measles Vaccine, which you get typically between 15 to 18 months. So you will be immune to measles, but as an older adult, sometimes that immunity can wane. So if you did a blood test and looked to see if there were antibodies for measles when you were in your 50s or 60s, you may not have them anymore. And you can see that that's why for pneumococcus, which is a bacteria that we get a vaccine for, often when you're above 65, you'll get revaccinated for pneumococcus. Same thing for herpes zoster. Even though most of us, anybody who's my age and older, probably had chickenpox as a child, but so we have some immunity, but often we'll get revaccinated as we get older. Any immunity can wane over time. With this coronavirus specifically, I don't think we know yet whether the immunity is lifelong. I think we'll probably know the answer to that in about 12 to 18 months, because the people who have been infected this time and recovered, we can recheck their antibodies and see if they still have the antibodies that they've produced. And then most likely this will be something that evolves over time, where blood tests will be done over the years to see how immune people are. I think my sense is that at least for a year or two, if you've been infected and recovered, you will be immune. Just thinking about how typical immunity against other coronaviruses and other viruses works, I think that would be the case, but I don't think we know that answer yet.
Yeah, just something I want to add to what John said. Those of you that are listening that are care providers, it is so very, very important for you to take care of yourselves as well. And if you have older people in the house, the revaccination is important. It's often, and I saw this in practice many times, that you are so focused, and rightfully so, on your child that you forget your own care. So you have to protect yourself with all the things that we talked about. And if any of you out there, be you people of color or otherwise, have chronic conditions like diabetes, hypertension, heart disease, or are on a special antibody for an inflammatory disease like rheumatoid arthritis or something like that, it is so very, very important that you keep in touch with your provider as well, that you make sure that you're in good health, because many of you are part of a 1 or 2 person team taking care of very, very fragile children. So sometimes the caretaker needs to make sure that care is being taken of them too.
Another question. Do you expect COVID-19 to fizzle out like SARS virus did? I haven't heard anything about SARS in so long, so I wonder if this will be typical since they are related. So that's a good question. They are related. I think with SARS, SARS had a much higher mortality, but was not quite as infectious. And this COVID-19 seems to have a lower mortality overall, but much more infectious. So I'm not sure it's going to fizzle out. There was a lot of hope early on that with warmer weather coming, that this coronavirus would go away, and that's typically what we see. Even in Atlanta, where we have a terrible viral season with rhinovirus and parainfluenza and influenza and human metapneumovirus all circulating in the winter, and how busy we get in the hospital in the winter. We have, and then when the warmer weather comes, those viruses tend to go away. People are out more. The warmer weather is not as hospitable for viruses. People tend to do a little bit better. That has not been the case with COVID-19, unfortunately, which is, I think, what we were all hoping for. I think, this is truly a novel virus, meaning that humans have not been infected with this before. So even though we're trying to generalize from the MERS experience and the SARS experience, there are some curveballs with COVID-19. I think one of them being that it doesn't fizzle out in the summer or in the spring. I think the other one being how infectious it really is, and how targeted towards older adults it is. I think my hope would be that as the infected population recovers and more people have immunity, I do think the spread of the virus will be checked to some extent, because there just won't be all these COVID-19 naive people that have never been contacted, have never had contact with it before. But unfortunately, to create that kind of herd immunity takes a long time and comes at the expense of, frankly, of people dying from COVID-19. One of the reasons that I'm so hopeful that there'll be a vaccine soon is that does help get a herd immunity in place without people suffering and dying from the illness. And I guess, the other thing, I'm not trying to be negative, but I would just say, we are really still at the beginning stages of this, even though it feels like this has been 1,000 years of social isolation. We're really at the beginning. I mean, even, New York, which is my hometown, which has had, a huge spike in cases, they think they're reaching the top of the spike, meaning that they're not having as many deaths and as many infected people as they did a few weeks ago, but they're still really at the top of how many infected people there are, and it's going to take a while for it to come down. And I think that's going to be the case for the rest of the country too. So again, not to be negative, but I really suspect this is not going to be a 3 to 4 month issue. This is going to be a 12 to 18 month issue, and it will change life as we know it. I think it'll change, for those of us with medically fragile kids or care for medically fragile kids. I think we do have to think about how we're going to get services for them and, medical therapies while keeping them safe. And, fortunately, we don't have a lot of experience with COVID-19 in the medically fragile population, just because we've tried to keep those kids at home. But I do think, the concerns raised are all valid, that we don't want medically fragile kids out with the general population just yet. And I think that may be true for a while. I was trying to end on a positive note, but I couldn't think of anything positive to say. LeRoy could be positive.
I'll try to positively, and I'm going to do something that Don can't do. First thing is that there is kind of a north-south kind of thing about this. So the flu seasons are reversed in the southern hemisphere to what we're seeing, and we're starting to see a surge in places like sub-Saharan Africa. The other thing I'd like to say, which those of you that know me, I'm not politically correct. It is so very, very important that you don't go with the flow with the political cycle on this. And I'm not taking any sides, but the talking heads are sometimes more focused on getting elected. So what I would suggest is so very important, go to reliable sources. I think what the committee is doing here with fragile kids and so forth is so important, but really go to sites like the CDC.gov, the Georgia Department of Health, and even your county departments of health, which are going to have the most up-to-date data. This has become a political football, and when things turn to politics, it tends to dominate the news cycle. And my wife actually makes me fast the news because I get so mad. But the point is that there are reliable sources who are apolitical and have your best interests at heart. And it's so important to follow the information that they're taking, as John and others have so correctly alluded to.
Just gonna go down for a couple more questions. My son is older. He has adrenal leukodystrophy. Doc has advised no caregivers at this time. How can I know if it will be safe for them to come back in? His doctor feels he will die if he catches the virus. Hard to manage his care without help long term, though. Yeah, it's very hard to give you advice about that because I really truly don't know the answer. I think, I think to Dr. Graham's earlier point, you and whoever's involved in caring for him in the family can not care for him if you guys are exhausted. So I do think at some point you will have to have help. I think the best thing you can do for anyone coming into the home is to have them masked and gloved the way we do in the hospital. So, I'll just tell you, for us in the hospital, we are trying to protect the patients from us as much as we're trying to protect ourselves from the patients. So we are, unless, for any kids who have respiratory illness, respiratory symptoms, we are using eye protection, a mask, and just to point out, it's a surgical mask, not an N95, just a regular surgical mask and gloves. And that should be adequate to protect your child from any caregivers that are in the home. Obviously, if you have a caregiver who has any respiratory symptoms, they should not be there. In adults, it's unclear if adults can be asymptomatic carriers, although I suspect that they can. So if you have someone in their 20s or 30s, it's possible that they can be an asymptomatic carrier. And I think, unfortunately, that's the risk that you would have to take at having a caregiver in the home. But I would say, good hand washing, adequate protective equipment, including goggles, mask, and gloves. And I think that's probably the most that you can do. But I do agree with Dr. Graham from the beginning. I mean, I think all caregivers get fatigue, and you're going to need help in the home, and you should be able to accept that help with just regular precautions that we would use. Do others receiving other vaccines during this heightened concern affect immune systems and being able to fight off COVID? We have not seen any evidence of that. So for example, people are still getting flu vaccines when COVID hit the United States. There's no evidence that the immune system response that's mounted from like an influenza vaccine would affect your ability to fight off coronavirus. And from a pathophysiologic standpoint, I'm not sure I could make that argument. I think people who are getting regular vaccines do mount an immune response, but it should not interfere with your ability to fight off COVID-19. LeRoy, can you think of anything about that? Not that I'm aware of.
I would agree with John. I have evidence that would support, doing that or any kind of cross immunity. Though again, it's important because these viruses do tend to affect people who are compromised more severely. So all the things that you do in terms of immunizations and self-care for the other things out there should be up to date. But unfortunately, I've not seen any evidence that you're getting any cross protection from some of the others at this point. And again, remember, it's terrible to say, but we're likely to see another season as this goes south and then comes back. So there may be a second wave. But the part of that is going to be, there's going to be some herd immunity. And as John says, he said the right things about how long it takes vaccines to be developed. I am fairly confident that, not that it's going to necessarily get it to us quicker, but everything is being done to get it quicker because this is such an existential, once in a generation kind of threat. So there are it's important for you to realize that there is hope, and there are a lot of very, very smart people working on this. And again, that's another reason to get your news from credible sources and so forth. The CDC briefings are awesome. The stuff that Dr. Fauci is doing and others is excellent. And just try and stay away from the if it bleeds, leads kind of sensationalism that's in the news. That's why conferences like this and searching reliable sources is so very important, because it's going to keep your mind in a good place to get through this as well.
I just wanted to add, as is no surprise, I guess, to everybody, I'm a huge proponent of vaccines, including influenza vaccine. And I know, that's something that people worry about, especially with fragile kids. I would just say it's important to be fully vaccinated. And I guess one thing that I didn't make clear, or I should have said, is, all the other stuff that we worry about is still there. And we have a stressed healthcare system on top of that. So like I was telling LeRoy, my parents live in New York and they're in their 70s and they're staying at home. But I found out yesterday that my dad's up on a ladder painting. And, he never thought anything about that, except that, if he falls off the ladder, there's no trauma services in New York because everything is about COVID. So, just remember that this is a stressed healthcare system, but everything else is still there. So, if your child gets sick, if you get sick, we will still take care of you, but the system is really focused on COVID-19. So, I just wanted to advocate, get your vaccines, get the flu shot, do everything you can to stay healthy, because the system is focused on other things right now. What is your recommendation? That was a hard question. What is your recommendation for a sibling with no health issues to return to school if they have an at-risk sibling who should not return to school within the next 12 to 18 months? That's a great question. I don't have a medically fragile child, but I do have 2 children. I was just thinking how I would, if one could go to school and the other couldn't. I think, for my kids, I think they are feeling socially isolated. They've had more screen time in the last couple months than they've had in their entire lives. But I think, we've kind of lightened up on that because we're trying to let them still stay in touch with their friends. I think if I had one child who could go to school and the other couldn't, you have to kind of consider the needs of both kids. I think I would probably send one kid to school and just try to keep them isolated from the other child as best as I could. I know that doesn't sound very realistic, and for most people in a single family home. But it's hard to isolate one kid who's overall healthy and not start to see some issues with that. But I think that's what I would do. I would send the kid back to school and just keep them separated from their sibling.
And this is Dr. Graham, and I would agree with John. And the other thing that can be reassuring is these school systems are not going to open up unless they think that's a safe proposition, meaning that they're not going to open it up when bringing those kids together is going to increase the threat. So I think at best case, it would be very unlikely that we see schools resume in the current calendar school year anyway. I think people are going to have to do what they're going to have to do in terms of teleeducation and things like that. But I think a good barometer of what the public health system thinks is going on is when they do let the schools go back. I think everybody is so very, very aware that the children can be important carriers or vectors of the disease that I think you're going to see restraint in that space. But like John, my children are grown now, but if I did have the opportunity to have one of my children get back to school when someone had declared it safe, I would do that and then do the precautions on the back end when that child comes back into the house each day.
All right. Well, I think that's all the questions that we had submitted. Dr. Graham, Dr. Popler, was there anything else that y'all wanted to mention, to talk about before we end this?
Go ahead, John.
I was just going to say, I know everyone's worried about their kids. We're worried about your kids too. So just call us if we can help. Our practice is available, and we want to bring the kids back in when they need to get seen. We're still trying to figure out the safest and best way to do that. I do think you'll start getting some information pushed out to you from us about telemedicine and phone calls. And but in the meantime, if you need something from us, we're certainly available and here.
I have really nothing to add to what John says, but I left that practice and it is populated with people as good or as better than when I was there. So I think they're as good as their word, and Children's Healthcare, I think, has really galvanized the support for the community. And I think you can feel very, very secure in the advice that you're getting from them.
We have an open office if you want to come back.
Oh, that's good. I'm good.
I'll save it for you just in case.
Okay, I appreciate that.
Dr. Graham, Dr. Popler, thank you all so much for being with us today, for answering our parents' questions, and we'll get this posted on our website under the Focus Activities at Home. We'll get it on our archive page as well for folks to be able to access all this great information. Thank you all so much for doing this.
Thanks
for the opportunity.
Take care.